Hello, creators. The 2024 Creator Circle Retreat, happening September 23rd through 26th in Vancouver, Washington, United States, is filling up fast. The registration deadline is June 1st, and we just have a few spots left. Visit wellnesscentercreators.com/retreats for all the info and to apply for your spot, or email me directly at kendall@wellnesscentercreators.com. Can't wait to see you there. As health and wellness providers, we know that better patient outcomes require a whole person, multidisciplinary approach that we just can't provide on our own. That's why I've started the Wellness Center Creators podcast. I'll be bringing you interviews with experts, tips, tricks, secrets, resources, systems, and solutions so that you don't have to reinvent the wheel. And creating your wellness center won't feel like starting over. Before we jump into today's episode, let's give a shout out to our sponsor, Jane, a clinic management software and EMR. Whether you're just starting to do your research or you've been contemplating switching your software for a while now, the Jane team understands that the process can feel intimidating. That's why their goal is to provide you with all the onboarding resources you need to make the switch as smooth as possible. Jane offers a personalized call to set up your account, a free date import, and a variety of online resources to get you up and running quickly. And if you need a helping hand along the way, you'll have access to unlimited phone, email, and chat support included in your Jane subscription. If you're interested in learning more, book a one-on-one demo at jane.app/switch. And if you decide to make the switch, don't forget to use the code WELLNESS1MO at sign-up to receive a 1-month grace period on your new Jane account. Welcome back, everyone, to the Wellness Center Creators podcast. Today on the show, we have a returning guest, Marco De Ciantis. Marco, thanks so much for being here again.
Thank you for the invite, and it's always a pleasure to be back and have some wonderful chats with you.
I know you've been on the show before, but let's have you kind of reintroduce yourself, tell our listeners who you are and how you got to be doing what you're doing present day.
Sure. So I'm a practicing chiropractor, and I was working in Toronto for just over 10 years where I owned and operated my own practice. And very recently, the last year, I started to become a contractor, so traveling different parts of Ontario to work as a locum. So just covering for another doc while they're away. And in the meantime, been traveling other parts of the world doing some humanitarian work as well. And then somehow juggling starting a new business in the meantime, Daphne Health Alliance, with our first clinical spot opening up this June in Belleville, Ontario. So it's just been this interesting ride in the last year that felt like I've worked and lived 3 to 4.
Amazing. And we're going to chat about Daphne Health Alliance in a little bit. I'm super excited about this. I think it's an amazing resource for the community. But I'd love to ask you about a few other things first. And we really want to focus today on this theme of, new practitioners, new graduates, and what are the options for new graduates in our field. And as a new graduate in any associated healthcare field we might think of, what would you say are the options to begin practicing?
Yeah, standard are, as soon as you come out, or the most common is associate. So you basically work for someone inside of their own office. Usually this works as a split in the sense of what it is that you can take. You could also start your own practice, particularly post-COVID. There's the costs that are associated with starting your own practice, particularly with equipment, have skyrocketed. So the amount of individuals going down that route has dramatically decreased. A very small percentage can take over, a familial practice if their parents or their brothers or some other, or sometimes cousins, are involved with the practice, or they can get involved in the healthcare system. both of those options are fewer and far between just by virtue of the fact that there's fewer spaces available for that. So by and large, when you come on out, you're probably going to be working for someone and for an indeterminate amount of time.
Yeah, I would agree. And you're speaking from the perspective of living and working in Canada,
Yeah.
and so in the U.S. we have similar terms, but we use terms like community health, and specifically for the mental health field, it's very common for new practitioners to come out of school and work in community mental health, as we call it, and these are like larger agencies serving typically like low income families or offering, free or reduced services, things like that is very common in the mental health field. And same with other modalities where they could work in community health or in a group practice or a clinic or go out on their own. So what would you say are some pros and cons of kind of going the path of solo practitioner? And I can speak to this too. I went straight
Yeah.
into my own practice after I graduated, which, some people have strong opinions about. What would you say are pros and cons? Solo practitioner versus joining a group right out the gate?
First and foremost, that takes a lot of courage in order to do that. That really, really does. Particularly once you're fresh out, you have all that intellectual, scholastic experience. And, by and large, for the last 4 years, how many years, you're not really taught on how to run a business, even though you're still in a healthcare business. I mean, the standard is you come out, you're in a lot of debt. And to try to get money in terms of funding to buy equipment to furnish or to start or to start a practice, that's a hard thing in order to do, and it's becoming even more tenuous in order to do that, particularly with the interest rates. So that's definitely one of those big cons that is ever present there. And you better make sure that you can earn and earn quickly in order to pay back whatever it is that you have. And that's just added pressure that could augment or affect on in how you practice. The pro is you're your own boss. Some other issues that I found associated with that, if you need someone to lean on, if you have clinical questions, practice questions, it's hard in order to have that team or those team members associated with you. So being part of a group, whether you're an associate or not, I mean, you do have other people's experience to rely on, although you're not running the ship yourself. That doesn't mean that you have to. It just means that there's a certain level of autonomy that you don't have in that clinical management. And, push comes to shove, maybe you want to run things your own way as opposed to being told how to run things.
Right. There's so much value in both of those types of experiences. And my biggest encouragement for people who want to start their own practice right out of school is it takes a lot of work to surround yourself with a community. And
Mhm.
it's really important to do that. So if I think about the mental health field, we're required to have postgraduate hours and supervision, clinical supervision from an approved supervisor for basically 2 years after we graduate with a master's degree, for example. And so that's sort of built in, like you have to have a supervisor, you have to have a mentor. Some of these modalities in our field aren't required to do that. And so, but even with mental health, it's super, super important to surround yourself with peers that you can lean on and talk to about cases and be in consultation with, because it's quite isolating to do that on your own, to be trying to do the initial parts of starting a business and that initial part of being a practitioner, being a new healthcare provider. And so
That's a lot of
definitely,
hats.
yeah, it's a lot of hats. It can be done, but it does take that extra step to kind of build that community
Yeah.
around yourself. So let's say someone does start their own practice. Let's say they're solo, maybe they end up bringing someone alongside them. You talk about this idea of the receptionless practice. So I want to ask you more about that. What are the positives? How can it help people, and maybe at the different points in their career of their or their kind of point in their business, or yeah, why are you passionate about this?
I found now being in practices where there were receptionists and receptions, and truth, my heart goes out to front desk staff and receptionists. I mean, they are the front line staff, and they can make or break a practice, irrespective of what it is that you can do or how well you think you do it or other people say. That is the first point of contact. Given though, in terms of once again the associated costs with running a practice, whether you're solo or with a group, the receptionist practice is a means in order of controlling um, your month to month expenses. And I found that this is in particular really works well with new grads because they can mitigate costs, and especially with people who've been out in the field 10, 15 years who either want to downsize or start mitigating some costs as well, because they already have that flow, that patient basis established where they can manage that own day-to-day team. And with these softwares that are out there right now that can really make this like foolproof and effortless, it's kind of a no-brainer. So, and I'm not saying that practices can't run without receptionists. I'm just saying that we're at a point right now where it can be done and that can provide value to certain members or the healthcare community, depending on where they are, particularly new grads and those who've been around for a while.
Yeah, I agree. And I'm so much like a human connection person,
Yeah.
and I will fight for having an in-person front desk all day at our clinics. And the softwares, like you mentioned, that are available now, make it much easier to have like a virtual assistant or
Yeah.
answering service. You need someone, there's a point where if you're solo, if you want to grow to your capacity or hire people to work with you, you need someone who is responding to clients and communicating with potential customers. So if you are not able to keep up with it, there has to be someone who is doing it. And that can
Absolutely.
be virtual assistant, answering service, what have you. But you're right. There are robust systems available. Our friend and colleague, Josh Satterley, who's
Yeah.
a fellow Jane Ambassador, has created a software. It's called Trust Driven Care. We've talked about it on the show before. I don't know if you've played around with it at all yet, but we've been using it in our clinic. And if I had the software when I was a new therapist in private practice, it's a absolute game changer for reducing the amount of time spent on these kind of admin tasks and communication tasks.
And you bring up an excellent point. Just having traveled to Uganda, where you're in literally places where there is no buildings to treat, you're actually treating in derelict buildings, or
Yeah.
you're in, let's say you're doing on-site training. You don't have that. You might have a reception in your practice, but they're not there on site. So to have these sort of programs or apps that are available where they could be the main source of how you book or just augmented, it really does. You do have situations in your career where it really is effortless and can really add, once again, that value.
Yeah. So let's talk about for new providers coming out of school, how can they really start to find their value and their uniqueness?
Great question. Because truth be told, doesn't matter what we practice. There's lots of people that came before us. There will be a lot of people that that come after us. And someone told me this years ago, whether you're an accountant, lawyer, doctor, chiro, doesn't matter. 50% of the class is still the bottom half of the class. So once again, doesn't matter. You have to be at the best, but what does set you apart? Now, we do, before we get into the field, by and large, interact with patients, whether they're underneath someone else's license or not. And I find that speaking towards 10 of your most recent patients, particularly ones that continue to book or that you really resonated with, asking them just to tell you, why do you come and see me? Straight up asking them, and try to get them to say it in 5 words or less and record it. You will find a certain theme. And that is what I think where your value lies and what will make you valuable in the sense of marketable, because whether you're a chiro, someone else does exactly the same thing, no one can be you. So asking 10 patients or 5 patients, depending on your experience, why because they don't have to come and see you, but they keep on coming to see you, find that out. And by and large, one thing that I've learned is If value means the amount of time you spend with someone, that can be a double-edged sword, because you will get busier and you will only still have this two hands and the same amount of time on this planet that everyone else does. So it's okay if someone says that they find the value is the amount of time you spend with them, but time cannot be valuable because it is finite. So it's some other characteristics that makes you you. And once that's reinforced, honestly, it's completely marketable.
Well said. I agree 100,000%. Absolutely. There's room for all of us.
Mm,
There's, you know, one thing about healthcare is people will always need care.
yeah,
And I know you and I share the same philosophy of really finding ways to provide high quality care to communities and giving people, just a better experience, a different experience. And so these are great tips. I'd love to hear more about Daphne Health Alliance. You and I have talked about it a bit, but I'd love for our listeners to learn about Daphne and how they can really benefit from this resource.
sure. So this is me not trying to necessarily reinvent the wheel, but adding another option in the sense of if you've already been established in a practice and need to downsize, in terms of multiple clinics and maybe the rent is too much and you want to go to receptionist, or you're fresh out and you want to find a place to work, but you're traveling, or you want to maintain that autonomy and more the earnings that you generate yourself, but still building a community of like-minded practitioners and other members inside the healthcare community. Daphne Health Alliance comes by creating these shared medical spaces. So our first space in Belleville, Ontario will have 5 rooms, and they're specifically designed for chiro, physio, massage, acupuncturists, naturopaths, and soon with music and art therapists. And what I mean by that is the amount, just the pragmatic features in terms of the amount of outlets, the size of the rooms. But the idea would be almost like a barbershop style, where you come in, you rent your chair, you're with other barbers, other members, and then the whole idea is here you still maintain your own autonomy. And Daphne can help in terms of building your own clientele. And the beautiful thing is, once we get multiple locations, if you are traveling, and this comes in particular with medical doctors that do injectables or registered nurses that do injectables, you can travel to different cities and have your space, rent it for a couple of days, a couple hours, see your patients, move on, and have nothing else to worry about in the sense
Yeah.
of maintenance or reception. We're focusing on areas as well that are underserved in Ontario, first and foremost. And what I mean by underserved is large population with few practitioners. So we already instill this um, closed patient accessibility in the sense of there's a need and a demand for multiple healthcare practitioners and whatever it is that they actually provide. And Belleville is going to be one of those spots. In it's a century-old building with 12, 14-foot ceilings. So I cannot wait to see this
It sounds
completely built out.
amazing.
Yeah, yeah, absolutely.
I'm so excited for you and for the community. If providers are listening to this and they're over, in their living room raising their hand because they want to be part of this first location, how can they get in touch with you?
Yeah. They can actually reach me at Dr. Marco at daphneclinics.com. And they can also just reach us at daphneclinics.com. And then you can reach out to me in that way. And you can also reach me on another email, marco.g.dechantis@gmail.com. Either one of them I'll respond to. And I'm really looking forward to giving people options that weren't necessarily available to us. And I really do mean this, making it not only easier for them, but getting a better foothold, particularly in these days, because, and you know this, it's just getting harder. It
Yeah.
really, really is. So to make it that much easier, I think is passing on the joy that we felt on to the next generation, because truth be told, we're not going to be doing this forever either. And someone's got to take over, and hopefully they're in a great space to carry on the joy that we're creating for others.
Marco, thank you so much for being here. It's always a pleasure to chat with you.
Same, likewise. Thank you again for the invite.
Have a good one.
You too.
Thanks so much for listening to the Wellness Center Creators Podcast. I hope you enjoyed the episode. Please visit our website at wellnesscentercreators.com for more show notes and additional episodes. By the way, I love hearing from listeners. Please send me an email at Kendall, Kendall, at wellnesscentercreators.com with your feedback. And if you send me a question, maybe I'll read it on the show, anonymously, of course. Thanks so much again for listening, and we'll catch you next time on the Wellness Center Creators Podcast.